So good afternoon, everybody. You're all very welcome to this afternoon's webinar. We're delighted to be joined this afternoon by Douglas Higgins and Aisling O'Dwyer, who are going to take us through carrying out COVID-19 risk assessments and looking at a number of other measures. Aisling and Douglas are with Peninsula. Douglas is just down the road from us, actually. He's just over in Kilkenny, so he's not too far away, and he's handy for to help any businesses, particularly in the southeast. Now, how the session will run, if you've got any comments or questions at any stage throughout, there's a chat function and a Q&A function on your screen. Just feel free to enter them in there and we can deal with them as the session progresses. And if you do really want to come on board to say something as well, you can pop it in there and we could arrange to have your microphone unmuted if necessary. Okay, so for now, enjoy the session, and I'm going to hand you over now to Douglas and Aisling.
Thanks very much, Brian, and good afternoon, everybody. As strange as it may appear, not seeing other faces. My name is Douglas Higgins. I'm a regional business manager for the Peninsula Group. There may be some faces that would recognize me over the years from running seminars, which was always lovely in person, and I look forward to returning to those days in the near future. For the moment, we'll do it the new way, as I've often said, which is on webinars and Zoom calls. We want to make this as simplified as we can for you today. I understand it'll be roughly about 25-30 minutes, and Aisling is going to assist to run through the different slides and give you some key information. What I do want to stress at this stage as well, there is always questions and we're very happy to answer them. Sometimes with health and safety, they might be a little bit more complex. So what I just want to reassure everybody at the start of this event, for those attending today, I will arrange a complimentary call between us all, and I can answer anything in further detail for you and get you that guidance and support that you require, and we'll pop up those details at the end. So I want everybody to understand, don't worry if a question doesn't come through now, or if we don't get to answer it right now, I will come back to you today and indeed and try answer anything we don't get done at the moment. But for now, I'm going to sit back. I'm going to enjoy listening to Aisling. Aisling O'Dwyer is a great colleague of mine, and I'm one of our lead health and safety consultants within the Peninsula Group in the Republic of Ireland. Aisling is a lady that may have dealt with some of you in the past in Carlow or indeed nationally by coming out to provide whether it's a compliance review for a business to see where you are, or indeed if we're installing a Peninsula health and safety system for you. So Aisling brings, as I say, a lot more experience than I learn myself on a daily basis. So Aisling, thanks very much for joining us this afternoon. I'll sit back and I'll hand it with you, and I hope everybody enjoys. Thank you very much.
Excellent. Thanks very much, Brian and Douglas, for the great introduction there. Look, I have a little bit about myself here. Yeah, as Douglas said, I'm a health and safety consultant with Peninsula. I've worked in the industry for a number of years across a wide range of sectors. In my current role, yeah, I assist clients with the implementation, management and review of their safety management systems. I also advise clients, I suppose, on all matters of safety, health and welfare at work. I stress welfare because sometimes that's forgotten about, okay? Guys, the agenda for this presentation is as follows. So what do we need to have prepared for reopening? What should we be doing in the workplace right now? What are the documentation requirements outlined by the national protocol? Just, I suppose, refresh your minds with that regard, and how to protect your employees' well-being. I'm going to put particular emphasis on risk assessment as well. I have a couple of slides there specifically on that, and then followed by the Q&A session at the end as well. Again, as Brian said at the start, if there is anything in particular that you want, I suppose, if you want to speak or anything like that, you can. That can be arranged. We can get your mic unmuted and we'll coordinate that. Okay, so I'm sure, well, I hope that you're all familiar with this return to work safety protocol document. It was released there as two Saturdays ago on the 9th of May by the Department of Health and the Department of Business, Enterprise and Innovation. Right, this protocol, and I stress, it should be used by all workplaces to adapt their workplace procedures and practices to fully comply with the COVID-19 related public health protection measures as identified as necessary by the HSE. Okay, it's quite a comprehensive document. It's almost 30 pages long. I hope to summarize it for you and clarify it for you via this webinar today. Again, I just want to go very briefly through the road map for reopening society and businesses. So I'm sure you've all noticed, I've noticed myself anyway, that the traffic increasing on the roads locally since the first phase reopening there on Monday. So again, that's your kind of outdoor construction, your garden centres, your repair services. Okay, so we are in the midst of phase 1 at the moment. Phase 2 then is happening the 8th of June. So I suppose keep in mind that small retailers will be allowed to open, provided they can maintain that 2-metre social distance. Work from home has to be maintained where possible. Okay, phase 3 then as well, we're going on to childcare. Again, there's kind of a question mark above this at the moment. Childcare for essential workers should be reopening. We're not sure how many of them will be able to reopen at that stage. Cafes, restaurants, they can reopen all the while thinking about they have to maintain that social distance. They have to have, I suppose, the proper sanitising and cleaning regimes in place prior to this. And remote work is to continue where possible. So you have to work from home if you are able to do so. The 20th of July then, we're looking at the hairdressers, beauty industry, museums, places of worship, so your religious organisations, hotels, hostels and caravan parks, they're all going to commence reopening in phase 4. Phase 5 then, I suppose we can, I don't know, can we ever call it back to normality? Our lives, I think, are going to be changed permanently following this to make sure nothing like this happens again. But most of the businesses will be reopened. So you'll see your education services will be reopened on a phased basis. So again, teachers, managers and stuff, they'll be able to enter the premises first. Recreation, pubs, nightclubs, they will begin to reopen. Again, they're going to have to consider max capacity, 2-metre social distancing. So we're not sure how this is going to actually go to work when we do come to that phase. But look, I'm sure they'll be well equipped to do so. Right, guys, this roadmap as well, I suppose it's subject to change as well in line with government guidelines. Look, if we're doing well at the moment, you can see the numbers have gone down of confirmed cases and fatalities, thankfully, that it is starting to decrease. But look, the government, they can change this whenever they want, really. If that number does start to go up again, I imagine they'd be extended. If we stay on the right track and the numbers are going down and down, they may be shortened as well. Okay, I suppose with this roadmap, I'd like businesses to keep in mind as well that the Health and Safety Authority have confirmed an increased number of inspectors to check on workplaces to ensure that they're following this national protocol. So as well as the businesses reopening, the HSA also are able to follow this roadmap and know which businesses to target first. Okay. Right, so the COVID-19 response plan itself. Okay, before returning to work, you need to create or update a business response plan to COVID-19. This requires, okay, I suppose having let's say a COVID-19 actual specific document outlining how you intend to manage things like personal hygiene instruction, hand washing, signage, respiratory etiquette signage, symptom signage, personal protective equipment, if it's applicable to you, how you intend on implementing it. You're traveling to and from work. Do you have multiple drivers in one vehicle? That needs to be avoided. Increased cleaning regime. So are you going to get your cleaners in more frequently? Are you going to give staff instruction on disinfecting their equipment? Again, social distancing specific to your business, how you intend on managing that. Are there any areas where you need to consider different kind of controls, partitions, etc.? Communal areas, your canteen, your welfare facilities, toilets, again, meeting rooms. Will you be able to do this virtually, or how you're going to manage that? It all needs to be documented, okay? Because we don't know what's going to happen further down the line. And I suppose if you don't have evidence that you had all this in place, is there a possibility for someone to take a case against you? So it's very important that you protect your business and you're complying with this protocol document, so the HSA will be happy with you. If something was to happen further down the line, that you're, I suppose, complying with your insurance requirements then as well. Okay, risk assessments and your safety statement then as well. So your safety statement should be updated, I suppose, to include a policy on infection control and specifically, I suppose, COVID-19. Okay, a few other things to consider there is reviewing other policies that would be already in your safety statement, like, I suppose, administering first aid, loan working policies, because there won't be as many people perhaps in the business at any one time. There could be somebody who's potentially alone. The driving for work, as I mentioned, they might need to be reviewed. Try and have one driver per vehicle where possible. And again, this might not always be able to be maintained, so that does need to be reviewed there as well. Okay, your risk assessments then. So it's very important that you review all risk assessments. Okay, and I'm going to go into that in further detail in a couple of slides there. Okay, again, you need to identify the high-risk workers, so the individual factors via the employee questionnaires, return to work document. You need to create contingency measures to address increased rates of worker absenteeism, reducing the spread of infection and changing work patterns, etc. Okay, the document heavily mentions that you need to communicate all of these plans with your workforce once finalized. You want them to have that peace of mind, come back to work, that you're doing everything right and it's safe for them to return. Okay, a little bit about, I suppose, a few other policies that need to be kind of reviewed and or updated before the return to work. So your sick leave policies, what is your sick leave policy? Is there anything that needs to be amended here? Make sure you consult and communicate with your employees again as changes are introduced. Okay, the temporary restructuring of work patterns may be required. So the prevention measures in your workplace, make sure all your handbooks are updated and all plans are discussed with your employees, and any discussions you have with employees surrounding any updates to sick leave or handbooks, make sure that a record is maintained as well, so you've documented evidence there that you have had discussions with them. Okay. Risk assessment. I suppose risk assessment is key, and it's going to really assist you in developing these documents that you require. So they're going to help you develop specific documents, especially your COVID-19, that response plan document, particularly. Okay, so risk assessment is essentially the identification of hazards within the workplace and then evaluating the risk associated with it. So, for example, let's say I'm going to keep current with this. If you think of COVID-19, okay, like if this as a hazard, well, is it a high level hazard? Yes, it would be. Okay, because not only is it highly contagious, there is possible fatal consequences from it. So it would be a high level risk. Okay, you need to, this is the hazard that's been identified. You need to, I suppose, determine appropriate ways of controlling this hazard then, for example. Okay, you can see this triangle I have here: elimination, substitution, engineering controls. This is the hierarchy of control. This is the approach you should take when implementing control measures. So, for example, the first one here, elimination. Is there any way you can physically remove the COVID-19 hazard? Okay. No, you can't. It's a fact of life. Can you physically remove somebody from being exposed to the hazard? Yes, you can. And in the protocol documents, it explains to you to have people working from home where possible. Okay, so at least you know that they're not going to come in and contract COVID-19 within the workplace. So that's physically removing them from the hazard. Okay, so substitution. Okay, this involves replace the hazard. Okay, I don't think we can replace COVID-19 with anything else. So this is not really an option here for the moment. Okay, your engineering controls then, you need to isolate people from the hazard. Okay, so this would involve, I suppose, introducing your social distancing, reorganizing the work layout, have separate offices, increase the distance between workstations, remove chairs or put signs above chairs, okay, telling people where they should sit, keeping that distance between them. Your floor stickers, your partitions. You can limit your access and egress routes. Okay, there are many, I suppose, engineering controls that you can implement as well, and there's great office solutions available at the moment as well, where you can have, I suppose, glass partitions with the meter marking on it, kind of designed carpets and everything as well, where you have little kind of 2-meter boxes. There's excellent solutions available at the moment. People are working on them continuously. Okay. And administrative controls then as well. So change the way people work. Okay, a lot of people are kind of considering these already. So reduce the number of people in the office. Only allow essential works to take place. Okay, so that would be with regards, let's say, your contractors. Do you need to get the walls painted? Not necessarily. Do you need to have somebody in to service the fire alarm? Yes. Okay, so you need to consider who you let into the building and is it essential? Okay, ensure the appointment times are strictly adhered to. Okay, so if you do have people coming in or need to visit the premises, make sure that you explain to them over the phone or via video conferencing that they have to come at a specific time. Okay, and if they don't come at a specific time, unfortunately, they might not be seen. Okay, this is happening a lot already. I've noticed myself just go into different places that you have to abide by your appointment times. Again, you're limiting the amount of people that are in the business at once. It's very important then, stagger break times then as well. So if you do have a number of people in the office that they only go to the canteen at certain times, when you think of the canteen area then as well, there's a lot to consider here. Okay, shared utensils and cutlery, shared appliances as well. So it's very important, so you limit the amount of people in there and that the cleaning regime is increased. Okay. Personal protective equipment, then you can see this is at the bottom of the triangle. This is kind of the last resort, I suppose. This is for all, it's not just coronavirus, but this hierarchy should be followed for all risk assessments. Personal protective equipment is always a last resort. I suppose with regards face masks, we have a lot of questions coming in. It's only recommended in situations where it's difficult to practice social distancing. So in shops or busy public transport. Wearing the face cloth, it may help prevent people who do not know they have the virus from spreading it to others. Okay, you have to really consider, is it applicable to your business as well? There's no specific guidance on who should wear it. Okay, the high risk healthcare workers, if you do have, I suppose, that direct contact as well, I would be considering personal protective equipment here too. Okay. In terms of the national protocol document, again, there's a few other things that need to be considered here. So we went over the risk assessments there and how to kind of conduct them. Contact tracing. So contact tracing finds cases quickly so they can be isolated to reduce the spread. An employee contact tracing log must be kept by all workers. Okay, the contact tracing log is to log all kind of times of close contact. And close contact would be considered 15 minutes speaking to a person within the 2 meters. So they have to log the details here. It's just to facilitate the HSE. Should there be a confirmed case within the workplace, they can facilitate the contact tracing then. Okay, you can see here, Peninsula provide all the forms that you need with regards to contact tracing. The protocol document also outlines that you need to display information and signs within the workplace. I'm sure you'd all be familiar with the yellow and black ones now. They're in most shops and outlets that are open at the moment. We also have a number of signs as well, but they do specifically require that you have signs on what to do if you do have symptoms. Okay, so that would be, I suppose, contact your GP or alert your supervisor, contact your GP, you go home, you self-isolate. Again, I'll go into that in more detail afterwards. Maintaining social distancing, proper hygiene measures, so correct hand hygiene. And then if you are required to wear PPE, like your face mask, that people are wearing them correctly. They need instruction on that also. Okay, the worker representatives then as well. The document does outline that you need to appoint somebody within the workplace. Ideally, it should be someone from management who would be familiar with that kind of role of monitoring. I suppose, prevention control measures. Okay, so they need to be appointed. It says a minimum 1 lead worker. The reason it says this is because I suppose it's very important. If you do have a small business, you have the 1 person appointed. There should be a backup to cover annual leave or sickness absence as well. Again, if you have a large workforce, the number of representatives should be proportionate to the numbers on the premises as well. And again, yeah, ideally appointed for management who'd be familiar with the kind of role. What their duties include should be ensuring social distancing is being adhered to, checking that workers are practicing good hygiene, ensure adequate stocks of sanitizing equipment and PPE where required, and all they need, I suppose, make sure that they're not putting themselves at risk. They need to receive training then, I suppose, specific to their role within your company, but what routes are they to monitor, what areas are they to monitor, where is the personal protective equipment held, where is the sanitizing equipment held, who do they need to contact to order more. That's the kind of stuff that needs to be, they need to be trained up on as well. EAP then, Employee Assistance Programme. Okay, employers should ensure that workers are made aware of and have access to any business provided employee assistance programme or occupational health service. Stress and anxiety, I suppose, from the pandemic being brought into the workplace from our home working is heightening the need for good mental health policies and control measures. So I suppose it's important to consider that you don't really know what your employees have experienced during this time at home. Could they have had traumatic events in the household as well? So it's very important, I suppose, that any services that are available to them is communicated to them. It's something that can be overlooked sometimes, but yeah, the well-being of employees really needs to be considered here. Okay, so the return to work questionnaire as well. I suppose this needs to be complete by all employees returning to the workplace. It's a self-declaration, so you'd issue the form to them and they complete it. Okay, it needs to look for, I suppose, details on have they travelled in the last 14 days? Are they presenting with any symptoms? Are they self-isolating or have they been instructed to self-isolate? Do they have any vulnerable people in the household? These are the kind of things that need to be considered, and I suppose you need to know about this before employees return to work. Okay, it should be complete 3 days prior to the return to work, and it should be complete if you do have people actually still working in the office at the minute. I know sometimes it mightn't, that is discouraged. You have to work remotely where possible, but I do understand people who don't have a proper setup at home, they may be using office facilities. So it's very important, I suppose, anyone who is still in the workplace needs to be completing this form every 2 weeks. Okay. Okay, right, once you have all of this in place, so you have your COVID-19 response plan, you've updated your safety statement, including all the relevant policies, you've completed your risk assessments, employees need to be inducted back into the business, okay? The training should at minimum include the latest kind of up-to-date advice and guidance on public health, what workers should do if they develop COVID-19 symptoms, details how the workplace is organised to address any risk from COVID-19 and outline the COVID-19 response plan to them. The identification of main contacts within the business in case of emergencies, so that would be your lead worker, your manager, your supervisor. And then I suppose it's something to consider here is temperature testing in line with public health and advice. Now, I haven't mentioned that previously. Again, some places they're kind of making this mandatory. Other people could argue that there's multiple reasons why you could have an elevated temperature going from outside to inside. Okay, so look, you just have to, I suppose, keep an eye out on government guidance with regards to temperature testing and see is it applicable to your industry. Okay. Suspected cases then as well. This should form part of your COVID-19 response plan. Okay, so communication with employees. Oh, I mentioned that, yeah, you should have the poster displayed so employees know what to do if they are displaying any symptoms of high temperature, shortness of breath, breathing difficulties, cough. Okay, there needs to be a response team. You should have an isolate, so the response team could be your manager and your lead worker representative. You need to have an isolation area as well also. So if someone does present symptoms and they come to you, you should be, ideally, you should have personal protective equipment available. You should be supplying that to them, bringing them to this area, ensuring that, again, that they don't touch anything, and the proper respiratory etiquette, I suppose, coughing into the crook of their elbow. using tissues, sanitizing their hands and disinfecting any areas. So you need to have this isolation area. It needs to be well ventilated. Ideally, there should be a door on it to separate them completely. Again, there needs to be, I suppose, a means of transport home needs to be considered. If they can drive home in their own car, that's ideal. If not, hopefully a member of the family can come and collect them. You don't want to send this person home on public transport if they are a suspected case. For obvious reasons, you don't want them infecting the rest of the public. Okay, clinical waste bags as well then. Look, clinical waste bags, what they are recommending there, if you do have a suspected case, they are using tissues, they need to dispose of them. You should be double bagging this, and this should be just going into your general waste stream, but it has to be double bagged and tied at the top. Right, guys, look, I went through a lot of stuff there in a good bit of detail. I kind of skimmed past a lot of it. But look, don't worry. What Peninsula are here to provide, I suppose, is to get your business ready post-COVID-19, to assist you on the return to work, to review your existing documentation, to create the new policies for your business, to assist in creating a business contingency plan, advise on prioritizing key personnel, assistance with creating new risk assessments, to help you promote better hygiene. I suppose we have, as you saw in the presentation, we've lots of posters there to meet this, and to ensure you're meeting your obligations. Again, it's not just in line with the National Protocol document, but ensure you're meeting your statutory obligations with regards, I suppose, the 2005 Act, the General Applications Regulations Act. We want you to ensure that we can give you that peace of mind there. And then to provide 24/7 support to qualified people. So we do have a helpline for health and safety, and it's 24/7, and the health and safety team man the phones all the time. So you can ask any question there as well. Right, I'm going to open up the question and answer session here as well. I suppose just in case, just before I go into any of the questions, if there's something that goes unanswered, Douglas is here as well, Douglas Higgins, my colleague. He's available to address any additional questions you have. His number is displayed here as well, 086 770 4538, if you have any further questions.
Aisling, thank you very much for the demonstration, and to the 16 participants. I hope, I suppose if nothing else, it might create an awareness for you, because, excuse me, it's not a COVID cough, by the way. I like to approach health and safety in a simplified format, ladies and gentlemen. As I've often said, and Brian would know over the years from working with him, a lot of this people are saying is all new. As I said, a lot of what our responsibilities are for health and safety isn't new. There's been many things we should have been doing as businesses over the years. Doesn't mean that we've all been doing it. What's happened now with COVID is that it has just escalated and brought a lot more to the forefront. And that I have found personally, just over the last 8 to 9 weeks in the company, is that a lot more incoming calls inquiring about health and safety itself. I understand there's probably a lot of businesses on this forum right now that probably have a very good health and safety system in place. And they may have statements on policies and risk assessments, and that is fantastic. And anybody that might want to just have that rubber stamped or verified, give us a call, that we can help you with this. I find sometimes there may be others that may find themselves in a position that they don't have, whether it's statements, policies, risk assessments, and don't know what to do about that either. And again, we can give some guidance and support on that too. Of course, those that know of us, we are a service provider. This is what we do for 90,000 businesses globally. But in Ireland, as I say, in our patch, we have about 6,500 small businesses. And most of our clients are small. They range from 2 staff to maybe 50, because you're family run or privately owned, and you might need a little bit of additional help and support. So I don't want anybody to feel that was like, oh my Lord, I don't have anything like this in place, and I never knew I had to do anything like this before. That's, as I said, it is new, as this is an addition to what you currently would have in place. And I use an analogy from one of our colleagues, one of Aisling's colleagues, because we're fond of cars. And again, to keep it simple. So when I often look at a car, I say the foundation of every car is the chassis. You have nothing without a chassis, and then we build upon that. And I often say in for business, for health and safety, your safety statement is your chassis. And then you're going to build on top of that health and safety so that you can obviously manage and monitor what you need to do and be able to prove that you do look after all the things that are reasonably requested of us as employers. And the only time a chassis is ever inspected is if we have an accident, or indeed I actually have a genuine inspection. And if it's found to be faulty, unfortunately, as the driver, I'll be to blame. Health and safety is a little bit similar in that respect. We don't worry about it until one, we have an accident or an incident, or we have an inspection, and we hope nobody will. So it is about being a little bit more proactive. I felt that over the years. So guys, like I say, anything we can do for you now, please pop in any questions. If anybody'd like to have a chat with me, I'm very happy to help you out. And what I'm going to do for any business is we can do another little video call if you like, and I may even bring in some of my health and safety colleagues to answer maybe some intrinsic questions you might have. I can answer most of them myself, but I don't want anybody to resist calling. This is a complimentary call. If we can assist you and you want to work with us, that's fantastic. Either way, if we can give you some advice and guidance that you can go off and start to do things yourselves, that's great too. So I'll open that up if anybody has queries or questions. I think Aisling is still with us. And
I am, Douglas, here. I have an interesting question that came in there.
Great.
About administering first aid during COVID-19. Okay. Look, it is important. Any first aider there, you need to, firstly, follow the standard control procedures. You must treat all people as if they're a suspected case, okay? Ideally, you should, if you are administering first aid to anybody, it should be done in a separate area. Additional personal protective equipment should be available for first aiders as well. So you should be wearing the mask because you are going to be close to the person. So you should be making personal protective equipment available. You have your little aprons, your gloves, and a face mask. Okay. Yeah, you shouldn't, if you're administering CPR, you shouldn't put your face too close to somebody to check their breathing. I suppose if people can apply, like if it's only, let's say, a small cut to hand or something like that, you sit there, you give them the instruction on how to disinfect the area and put on the plaster as well. Okay, I think there is specific guidelines again in that protocol document should you need to refer back to it too. That's just one question in there, Douglas, for the moment.
Well, there's also a comment there from Jane. She's a retail shop in Carlowtown. She's a sole trader working on her own with no employees but a fit dance shoes and children from the age of 3 all the way up to adults. Is fitting permitted, recommended? If somebody is fitted and doesn't purchase, what would the protocol be? And also, could I go through several pairs of shoes? Can they be refitted onto the next person? And obviously, will I be in very close proximity to customers? You know, it's trying to come up with a plan in relation to that. Yeah. So any particular advice in that? Because there's a lot of contact points in there. Plus, there's the issue there with regard to trying on items and then how they're dealt with as well.
And it's a very good question because it's applicable to many as well, Brian, and to the guest in the retail sector, whether anything that we're going to try on. Aisling, I was it yourself that had spoken about this recently, about trying on and retrying clothing or shoes and so forth? Was that yourself?
It wasn't myself, Douglas. It's a good question, and I don't have anything particularly specific to that, but as I suppose Brian said there as well, it's a high risk, it's a close contact activity. Like, I don't know about swapping equipment. You're putting a lot of, I suppose, confidence on your customer that they're clean and that they've washed their hands, that they're abiding by all these hygiene measures. And again, as I mentioned in phase 2 there, when the small retailers do open, they're only allowed to open on the premise that they're able to maintain that 2 meter social distance. That would need to be thoroughly risk assessed. Okay.
Yeah.
Thoroughly risk assessed by your business and your needs.
I understand it's a difficult question.
Yes.
Because again, and a lot of this as well, many aspects that we haven't faced as yet. I know what's spoken about from someone recently, somebody else that actually has multiple, I believe it was shoe stores, and they were curious about when they came back, because they had been informed that they were told that anybody trying on a shoe will also have to put on like a shoe glove,
yes,
in essence, before it goes into the shoe, and then afterwards would have to be obviously binned in the appropriate manner as well. But I'll look into that a little bit further for whoever that query came from, because it's not a straightforward answer, because I don't think anybody actually knows that as yet.
I think I know, even I've spoke to a couple of retailers, and they've indicated on like that where, yeah, change rooms have been sanitized after somebody goes in and tries on, and some of the stock to try on holding it aside. But, you know, it is quite difficult, and, you know, you can't hold that level of stock to be able to continue in that way. You know, and whether it is that you have, I suppose, like socks that they have to put on that are taken away, and whether they're disposed of, or what is, you know, but I suppose there's a lot of different measures, and it's about highlighting the different contact points along that journey and seeing what way we can alleviate the risk. But we'll work on that, and we can see what else we can get. And I know Alison was asking there for Douglas's and Ashling's email addresses. That's no problem. We can arrange to send the contact details on. We will be sending the slides on following the presentation as well. So we'll have those out to you within the next 24 hours. And the whole session has been recorded as well. So we will send a link onto that, so you'll be able to look back on anything and see what different advice Ashling has given.
Absolutely. And of course, and thanks very much, Brian. I know you can share my contact details. As I say, I'm not too far from anybody in Carlow or Kilkenny, and I welcome any challenges, and we can help you guys. Please don't hesitate making contact, email, phone call, and we look after you the best we can.
No problem. Well, I suppose for me in the chamber, you know, and as Ashling had alluded to, consultation is the key, unless, you know, with your employees, but also the opportunity for businesses to be able to consult with Doug and consult with Ashling, you know, further in relation to your own specific cases. So don't hesitate to get in touch with them and see what way, because, you know, not one business is going to have a query the exact same as their next door neighbor, because there's so many different factors. And the biggest factor that we have in all of our businesses is the human factor, and it changes from one business to the next. But I do hope that you've enjoyed this afternoon's webinar. Thank you very much to Ashling and to Douglas for taking the time to join us and deliver this presentation. It's been really appreciated and really worthwhile. We'll be continuing to run our webinars. We don't have one scheduled now this week on Thursday, but we will be back next week with a few more. And as I said, you can tune into the Chamber website for to play back on any of our webinars that have been taking place up to now, and we look forward to seeing you again soon. So for now, keep safe, and thank you.
Thank you very much.
Thanks very much. Bye-bye.
Bye-bye.